Hi friends, welcome back to Dip Clinic. If you're new to the channel, my name's Mike and I'm a cognitive behavioural therapist and first-year trainee doctor in health psychology. Today we're going to hopefully have a straightforward video that discusses the difference between counsellors, therapists and psychologists. Let's get started. So first of all, the reason why I wanted to do this video is because I think there's a lot of confusion and there's a lot of different terms that are used quite interchangeably in psychology. So things such as counsellor, therapist, psychotherapist, psychologist, psychiatrist tend to be very confusing for people who aren't aware of what the differences are between them. I know that personally I've been training in psychology and therapy for several years now, and I'm pretty sure that my mom still refers to me as a psychiatrist, which is definitely not the case. So if anything, hopefully this video clears up a few things for her as well. So let's take a look at the definitions of what each of these terms means and what each of these practitioners are able and aren't able to do. I think that starting out, it's probably most useful to look at what psychologists do. So technically anybody who has studied psychology can call themselves a psychologist because this isn't a protected title. However, there are several protected titles, so this means that by law you cannot call yourself one of these psychologists within the field. And these protected titles include clinical psychology, health psychology, counselling psychology, educational psychology, forensic psychology, and sports and exercise psychology. So really, when we do speak of psychologists, we're usually referring to somebody who is quite specialised and quite highly trained within the field. But I think this description of psychologists is probably one of the best in understanding exactly what they do. And so this definition is that psychologists are normally described as being applied or research-oriented. Those who are applied will use their knowledge in a practical capacity to help patients or clients. Those who are research-oriented will aim to further society's knowledge of the human mind. And so as you can see, this is quite a broad category of work and what psychologists may do. But fundamentally, it may be useful to remember that psychologists are very highly trained, highly specialised, and usually in an applied or a research-based field. So moving on to counsellors. So this is where things can get a little bit confusing because there is definitely an overlap between therapists, counsellors and psychologists as well. And so I think the easiest way that we can define counsellors is usually somebody who is trained in a person-centred or a counselling technique. So many counsellors, for example, will have trained in something called person-centred therapy or Rogerian therapy. And this is often where, instead of challenging the client like we do in cognitive behavioural therapy, the main techniques are usually sitting with the person while they experience their emotions, paraphrasing certain concepts that they've brought up, and summarising the information that the client's giving so that they can come to their own conclusions. And this is also quite well aligned with the definition of counselling, which is a person trained to give guidance on personal or psychological difficulties. It's important to remember that there's several types of counselling. So you have things such as group counselling, relationship counselling, and also individual counselling. But the underlying philosophy of counselling is that the client is the expert, and so they have the knowledge and the expertise in able to help themselves to overcome the emotional or the psychological difficulties that they're experiencing. And so this transitions us quite nicely into psychotherapists or therapists, as this is probably the biggest difference between counselling and the therapist group. So due to the training that I've received and the individuals that I work with, I would class myself as a psychotherapist. And so when we have a look at the definition of a psychotherapist, this is categorised as the use of psychological methods, particularly when based on regular personal interaction with individuals, to help a person change behaviour and overcome problems in desired ways. So as you can see, the definitions between all three occupations have very close interlinks. But I think one thing that particularly stands out with psychotherapy is the specific use of a model. Now this isn't to say that counsellors don't use a model when they are providing counselling. However, the difference with psychotherapists, such as myself, is that we're usually using a specific model of therapy. So something like cognitive behavioural therapy, acceptance and commitment-based therapy, or even psychodynamic or psychoanalytic therapy for some individuals. And in psychotherapy, we're incorporating a lot more techniques based on our specific model rather than a counsellor. And I think this can be a bit more clearly seen within an individual session. So usually when we look at a person-centred or a counselling approach, there's a lot of time where the client is speaking to us and we're reflecting back the information that they're saying. So if they say that they've had a bad day, they're struggling with their difficulties, we may paraphrase that as, okay, so I understand that you're having some difficulties at the moment or that you're struggling. And based on that, they'll be able to provide us more information and hopefully come to their own conclusions. Whereas a psychotherapist, particularly in a CBT model, if somebody says that they're having a difficult time, usually we'll have a look at the specific thoughts. Okay, so why are you having a hard time at the moment? And they may say, well, I'm having difficulties at work. I think that I'm not up to the job. And so we would take that cognition or that thought and we would say, okay, so what evidence would suggest that you're not doing well at your job, and what evidence would suggest that that's maybe not necessarily true? And so by balancing these evidences and challenging the client a little bit more, we can understand about their difficulties and provide specific interventions on how to support them with it. And so I think to wrap all of this together, if we really have a look at all three occupations together, psychologists have usually completed an academic qualification in psychology, and if they have a protected title such as clinical psychologist, then that will be a legal title that they carry and will usually work with individuals who are typically more severe than somebody who a counsellor may see. A psychotherapist, on the other hand, is usually trained in a very specific model, so something like CBT, where we're working with usually, again, more high-risk clients than a counsellor, and a little bit more psychopathology or mental health disorders as well. And finally, we have counsellors. So counsellors are usually providing talking therapies in order to help individuals come to their own conclusions on how they can overcome challenges in their life. Now, I will give a final disclaimer that this isn't always absolutely necessarily true. And so there are individual differences in what each practitioner will be doing, but based off the information that I've seen training and working in psychology, and as well as some of the definitions, I think this is probably one of the better ways that we can define it. And in answer to a question I get very often on which of these practitioners is better, I don't think there really is an answer to that. Every individual is different, all of our clients want or need different things, and it's our responsibility to ensure that we can provide a holistic and a well-rounded approach with all of the practitioners from all of the areas that we can. And so for some, a clinical psychologist may be better, for some, a counsellor may be better. It does just really depend on the individual case-to-case basis. Well, I hope that this has given you a little bit more information about what all of these individuals do, and feel free to leave a comment below if you think there's any specific differences between those three individuals. If you haven't already, please feel free to leave a like and subscribe to the channel. Once again, thanks for watching, stay safe, and we'll look forward to seeing you in the next one. Take care.